Hello everyone. The rise in cancer diagnosis among younger women is truly concerning. The cancer treatments for this age group can significantly impact fertility. Let us know more about it. Today we have Dr. Srinivas Prasad, an experienced cancer specialist and surgeon from Horizon Cancer Care, to provide deeper insight on this critical issue. Namaste, doctor.
Namaste. Hello, everyone.
So, doctor, what are the factors that contribute to this trend?
There are several factors that may contribute to the increased number of cancers which are diagnosed in younger women. Of these, the most important one is the lifestyle choices one makes. The obesity, which is very common in our society, which is in turn a result of sedentary lifestyle where they sit for long hours and work, especially in many of the modern professions, where there is very less physical activity. Also, consumption of diet which has lots of processed foods. All these have a connection with the cancer, where the cancer incidence happens. Especially in the obesity, there is inflammation in the body. Also, there is hormonal changes. They increase the risk of cancers. So, as the lifestyle is becoming modern trends, the cancer is increasing. Likewise, factors like pregnancy, where the first pregnancy is very much delayed, because of the professional commitment, people are getting married late and having children at a later age. This also increases the risk of cancer, because the body is exposed to the hormones produced in the body, and they are the risk factors, especially for the breast and ovarian cancer. Having less number of children, that is no children or having one children, also increase the risk of cancers. So, and moreover, the cancer awareness is increasing, and many people are getting advanced screening cancer tests. This also increasing the number of diagnoses of cancers, especially in the younger age group. So these are all the risk factors which increases the diagnosis of cancers in younger women.
So, cancer and fertility, particularly the ability to bear children, is deeply interconnected. What is the impact of cancer treatment on fertility?
Yeah, cancer treatment includes chemotherapy, radiotherapy, surgery, hormonal therapy, and many more. So these treatments can be given as a single modality, or they can be combined to maximize the cure rates depending on the stage. So when the treatments have given, they have impact on the body, other cells, as well as the same on the ovarian tissue or the reproductive cells also. So for example, if you give chemotherapy, which is given intravenously, it has side effects on the normal tissue anywhere in the body, like intestines, hair, skin, everywhere. Likewise, it also has the effect on the ovarian cells, where the number of eggs in the ovary, the number comes down. Also, premature ovarian failure means the menopause happens at a younger age. So these are the side effects of the chemotherapy. The radiotherapy treatment is also one sort of the treatment used for cancers, where it uses high energy X-rays to kill the cancer cells. So especially when the radiation is delivered in the region of the pelvis, where the reproductive organs are there, like ovaries, uterus, and the cervix, and sometimes in males near the genitalia also, it may cause damage to these cells, decreasing the fertility. Sometimes the cancer may affect the reproductive organs like ovaries, uterus, cervix, or the testis also, where the organ has to be removed. That also results in, obviously, the decrease in fertility. So nowadays we do organ preserving surgeries for such things also. The surgery which is happening in and surrounding region of that, where we are not removing the reproductive organ, can also have a negative impact on the fertility. So these are all the reasons why the fertility get affected with the cancer treatments.
What precautions do you take to preserve and safeguard fertility?
Yeah, before starting the treatment, all the patients they should consult and discuss with the healthcare team, especially the fertility specialist also. So this will help them in planning their future and taking necessary steps so that the informed decisions are made. We first assess the infertility risk for a given individual patient based on several factors. So for example, the most important thing is the age. So when a person is diagnosed with cancer in 20s and 30s, they may require more intense fertility measures than a person who diagnosed with a cancer in the late age group, like around 40, 45, where already the ovarian reserve is very less. So we may not pursue much about the fertility. The another important factor is the stage of the cancer. In early stage cancers, the fertility measures are intense. because the cancer is going to be cured and they are going to give a longer life. Whereas in advanced cancers, because the outcome is not good, we may sometimes may not suggest or we counsel them not to have any infertility measures. The site of the cancer is also one of the important reason. Like there is suppose a cancer which is away from the reproductive hormones, say that a cancer of the head and neck like thyroid, parotid tumors or skin tumors, some other tumors where the treatment is done with surgery or radiotherapy, it is not going to affect the reproductive organs like ovaries or the testes. So, there also the intensive measures are not required. In the same way, type of treatment like only surgery or only radiotherapy away from the fertility organs is also there is no need for any intensive fertility measurements. So, before planning for any strategy, we must discuss with the patients in detail about the treatment side effects, their outcome over a period of time, and what is their fertility risk.
So, could you please elaborate the fertility preservation options before starting the treatment?
So, one example is that one is cryopreservation, where it is called freezing technique, where the ovum from the ovaries and the sperms in the men are freezed. So, the technique is called cryopreservation. This can be used later after the treatment for the fertility. The same way, embryos can also be preserved. The embryo preservation is better than the preserving the ovaries and sperms because it has got a more resistance and sturdy in freezing techniques. The newer options is preservation of the ovarian tissue or the tissue from the testis. This can be banned, means they are also frozen, and once the treatment is over, they can be re-implanted into the patient and they produce the ovum or the sperms in respective gender. So, these techniques are especially used in prepubertal people where the respective organs like ovaries, ovum in the eggs in the ovum and sperms are not yet matured or produced. So, these techniques are experimental still but can be used. The other techniques that can be used are like adoption or surrogacy, especially when the reproductive organs like uterus or ovaries are removed because of the cancer affecting those organs. So, surrogacy is where the pregnancy is born by some other woman, but the eggs are from the same mother. So, these are the certain techniques which are used before starting the treatment.
So, what precautions do you take during chemotherapy?
So, during the treatment, especially chemotherapy, we temporarily suppress the ovarian function, means the ovary looks dormant. So, this is achieved by using certain medications which is given as an injection it's called GnRH agonist injections. So, this will protect the ovaries during the treatment to reduce having less effect on the ovaries. While during administering radiotherapy, we make a shield to protect the reproductive organs like especially ovaries and testes when the radiation is required in the abdomen or pelvic area. When the cancer affects the ovaries or the uterus or the cervix and the testes, we perform organ preserving operations like suppose there is a cancer in the ovary. So, we can preserve the uterus and other ovary which are sufficient for the fertility. But it is very important that the cancer should be in early stage. So, here lies the importance of detecting the cancer very early. The same way, the cervical cancers, if they are detected very early by screening methods, we can just remove that portion and preserve the uterus. So, these are the important preservations by surgery. Sometimes when the radiation is required and the ovaries are coming in the field of radiation. So, by performing a surgery, we outplace the ovaries in a different places. It's called transposition of the ovaries.
So, what is the success rate of these fertility preservation methods?
It depends on several factors. The most important is age of the patient. The younger people have a lot of ovarian reserve, means there are a lot of eggs are there and ovarian function is very good. So, in this, when we do a fertility preservation of the ovum and in men and sperm, the results are going to be better. So, also preservation of embryos is better than the ovum and the sperms because embryos are robust and the success rate becomes more. Another important factor is if we take the eggs and from the woman in a later age, the number of yield of eggs which comes are less. So, in younger people, the egg number is increased when we collect the eggs. So, when the egg collection is more than 15 number, the success rate of pregnancy becomes almost 80%. So, the other newer methods are experimental like ovarian tissue preservation and testicular tissue preservation. They are experimental, but there are anecdotal reports where this is done. So it may be become common in future.
What are the latest advancements in fertility preservation methods?
The normal fertility preservation, we have discussed about the egg preservation and embryo preservation. The another newer technique is in vitro maturation. Normally, for the maturation of the eggs, women have to receive hormone injections. So, they take certain time. So, in vitro maturation is the maturation of the eggs outside the body in the lab. So, what are the advantages? A person where the treatment has to be started very early, there is no time for the injections to take. In that particular individuals, this technique may help. In vitro maturation. Also, where certain women who may have polycystic ovary syndrome, they already have a lot of estrogens in their body. For them, it is not safe. The injections of hormone injections are not safe. For them also, in vitro fertilization, where they need not take injections for the maturation of the ovary. So the another newer technique is the cryopreservation techniques are improved, so that the quality of the eggs or the embryo is better when they brought back before running the process. The tissue banking, already we have discussed about that, about the ovarian preservation and the testicular preservation. There are incidences where the pregnancy has happened, but it is still under experimental. So there it is going to be a future process. The other important thing is doing a genetic testing on the embryo. So if we have few embryos, we can test which embryo to be implanted based on this genetic testing, because especially in women who are having pregnancy, planning for pregnancy in the latter age, around 38, 40, 42 ages, there can be certain syndromes which can pass on from the parents because of the advanced age, like Down syndrome, etc. So these can be detected by a genetic testing performing on the embryo. So this is one of the future promising techniques. The incorporation of artificial intelligence into the embryo selection. So which embryos are better for and give better pregnancy and success rates, that can also be comes into the future.
Thank you so much, doctor. I'm sure this information is going to help a lot of women out there. For further assistance, kindly contact the details given below. Thank you.
Thanks, Akanksha. Thank you, everyone.